Pote unapotegea, mimi ni wako Maureen Magak hapa ndani ya Dayo Radio, where we are reaching and empowering the masses. Oh my goodness, how I have missed this day, and also how we have amazing topic to talk about today. And of course, niko na mgeni wangu ameshafika studioni, and very soon unaenda kumuona. Na today is a very good day, it's a very chilly morning, where you are tuning from, and I hope you're safe, and I hope that the weather is doing you great. Of course, keep healthy, keep warm. With me in the studio, you'll get to meet her later, but I just want to tell you that join us at Dayo Radio, where you find us on Facebook, you find us on YouTube, and also you go to www.dayoradio.or.ke, and of course pia tutumie ujumbe kwa nambari ya simu 0790204487. Now, as we continue our topic for today, msikilizaji, I want to let you know that you can send in your comments. You can also send in anything you want to ask. Our guest is already in the studio with us, because today we discuss matters that is very close to you, very close to us, and very close to young people at the heart of the community. And without wasting any time, let's dive into an introduction of the topic, where we talk about AYP strategy 2024-2029. They just launched, but of course I'm not going to talk about it alone. Karibu sana mgeni wetu, and just jitambulishe tu jina, who are you?
Thank you sana Maureen. My name's Razia Miraj. I coordinate sub-county gender-based violence, adolescents and young person program and mental health in Kisauni and Nyali Health Department. Thank you very much.
Oh, amazing. Thank you so much, Razia. It is a pleasure to have you in our Dayo Radio studios, and also it's a pleasure that you're the right person to speak about, adolescent and young people. And we just launched AYP strategy 2024-2029. How do you feel about this?
I feel great.
Of course. Would you like to tell us what is this AYP strategy for someone who doesn't know what it is? Yeah.
A strategy is a 5 years plan on how you're going to implement your issues in relation to programming. Mm-hmm. So a strategy, it's like a blueprint. Just I can give you a comparison like a constitution that you have to adhere to it. And it really helps in terms of service delivery and improving health outcomes. So a strategy is a very like a blueprint that is meant for the young people. When we are implementing young people programming, you have to have like a guideline, like a strategy. And a strategy is the way to go.
Oh, thank you so much. And you just reminded me something, that there was AYP strategy 2022, 2018, 2022, and that was 5 years as well, and that phased out. Would you mind to maybe kujulisha wasikilizaji and everyone that has to really learn about this? How did it go? Did it bring any changes or impact as far as adolescent and young people as health programming goes?
Yeah, thank you very much, Maureen, for giving me this opportunity. The previous 2018 to 2022 strategy, it had a lot of good things on board. Among the things were SRH services, HIV programming, and issues to do with teen pregnancy. And during that era, we've managed to reduce in terms of statistics in Kenya and even in Mombasa as a county from 18, where in Kenya we were at 18. During that time in Mombasa we are at 11%. So it is a great milestone, and we are happy for those achievements. Apart from that, it also was able to address the reproductive health issues about our young people. When I say reproductive, our young people need to appreciate that behavior change is the way to go. If behavior change is the way to go, then how will it be implemented? Because we're encouraging our young people, when they get information is key for them to make informed decision. And we want a very healthy, productive young society who are going to lead us in the next future time. So why behavioral change? Kwa nini tubadilishe mienendo is because HIV prevalence in Mombasa has become a challenge that we need to address. As we are talking now, the national prevalence of HIV is at 5.6. Comparison with Mombasa, we are at 7.4. We are still far much behind. And the only way we can approach it is through now having multi-sectoral approach, where we involved civil society, we involve the government official who are going to help us to key out these issues of HIV. You can attest, the people of Mombasa, the young people are being exploited, and in areas like Bamburi Mutambo, our young people are being solicited for just a cheap sex. So how can we health educate our young people to at least say no and have an informed choice? That is the only way we can have a sitting, have a discussion, have a health education to them, let them speak out what are their issues, why they cannot abstain. We listen to them, then we chat our way forward. Because as we are heading towards this new strategy, it has a lot of key issues that we've already added into the previous strategy. Among the key issues that we've added include mental health. Suicide cases is on the rise, and our young people are taking their life just because this thing that they had planned didn't go through. But we are telling them, in the world there are challenges, and these challenges will make them a productive young person who is going to be the next future president and future leaders of tomorrow. That is the information we are passing to the young people. And I say, yes, they will. Nothing for us without us. Young people have been fully involved in their leadership in terms of participation, in terms of putting their input. This new strategy, it's all about young people. It is nothing for us without us, as the slogan goes. So young people, we are very proud of you for making this dream come to reality. This is the second edition of the AYP launch, and the key thematic areas, we have the key 4 objectives that the AYP strategy keeps talking about in terms of AYP strategy. So we have one about social, improve the health outcomes. When I say health outcome, it means health seeking behavior, rather than going to the traditional healers seeking for certain services. Kindly.
At the moment, are there any young people that, take that route to go to traditional healers? Do they still exist?
They still exist. Like post-bottle care, when a research was done by I think it's Aga Khan, they were telling us this is, we have some post-bottle information that is going on board. The statistics, they don't have their real statistics, but they have cases while they were doing their research and survey. There are young people who broadly stated that since the hospital do not offer abortions, and which we don't advocate for it, that is why I kept on saying behavioral change is the way to go.
Yeah.
We are not going to terminate a child. A child has already been conceived. She'll go up to the full, be given birth, and we link this young person to school, back to school, or vocational training, to make this young person an informed person and in future, so that to make an assertive decision of saying no when he means no.
So when it comes to, we just talked about abortion, and knowing that in Mombasa County specifically, this is like a hot topic, a no touch. Do not, talk about it, and it happens, right? So going back to the AYP itself, what are these components, or how is it structured to meet the needs of young people, to make sure that the behavioral change you're saying is going to be catered for, the good health seeking, push is going to be catered for? Yeah.
Okay. Thank you very much. We have our youth-friendly clinics. We have standalone and we have integrated. Like for Nyali, we have 7 youth-friendly clinic. 1 is a standalone and 6 integrated services. Why? Is because of the space in our public facility, but we are not failing to deliver the youth-friendly services. The fact that we are limited of space doesn't mean that we cannot deliver. So what happened in our youth-friendly space? Adolescents get to access their youth-friendly clinic at any given point from Monday to Friday. And usually with adolescents, they prefer coming in the afternoon when the general population, that is their moms, their aunties have already received healthcare services in the morning. So they will visit our youth-friendly space. Like for Bamburi, the standalone, we have a very refurbished container where it offers psychosocial support. It offers outpatient services where we screen for sexually transmitted infections, HIV testing. We are encouraging them, kindly be bold and say, I need to know my status. That is the only way we can reduce the prevalence, because with HIV, it is among the adolescents, it is at a higher stage compared to the national, and the adolescents are leading in that. So we are working together with different civil society just to create advocacy to the community. We have targeted youth forums, we have community dialogues with our parents. We want to address the parents. It cannot be an adolescence only. It is a holistic. You are looking at a setup of a family. These adolescents, what will lead him or her to engage in the sexual activities is because we have a problem at home, the family setup. Maybe there are disagreement between parents. Maybe there are some social economic status in terms of poverty. Sometimes parent will make the adolescents to go and look for a way of earning an income. And that predisposes these adolescents to HIV infection and STIs infection. So we really need to empower our young people. As in, while you're going out, you've been sent, kindly make an assertive decision of saying, no, my life, my healthy, productive life should not be ended with HIV and STIs infection.
Yeah. So thank you so much for a great detailing of, the AYP strategy components. And I like that you gave us a preview of AYP strategy 2018-2022, so that we can also kind of connect the kind of impact it brought. We can also have something to look forward. Interestingly, you said that teenage pregnancy dropped, and now we are at 11%.
Currently, as in 22 KDHIS, we have reached 9%.
We have reached 9%.
Yes.
That is good, but we want to reach 0%, just aiming so high, because adolescent pregnancy means a child was defiled somewhere.
Yes.
And of course, as you push for no pregnancy for teenagers, you push for then 0 SGBV.
Exactly.
Kabisa to a girl child of any age. And now with focus to AYP. And also I like what you're talking about in terms of the, existing youth-friendly services. And I pick it from there. It has always been an issue. It has always been a topic of discussion among the young people. When we meet them or when they share their voice, they're saying, yes, kuna youth-friendly services. But ukiingia pale, the people that are providing these services ni watu wakubwa ambao wamezidi umri sana. So the service is there, but they cannot get in to access it kwa sababu watapata watu ambao kunja sura pale, pengine wako kwa ile umri ambao is easy for us Africans to judge. Do you know how older people, older than this young age, somehow they don't have to tell you something. The look can just tell you. Umefika pale, you are 17, for example. Honestly, even want to ask a question about STIs. But the look is, you get. So this is scary. So since you said there is so much, like 7 youth-friendly services, centers, what is the age group of service providers in there so that young people listening to you from your area, Nyali sub-county, will be like, yo, wow, this has changed. Wacha tukimbie tupate services. Tell them.
Thank you very much. It is a very good topic that you've brought. We have an age group between 26 to 37. Those are the people who've been allocated to a youth-friendly centers. Why? They have been trained, a series of training on how to provide a youth-friendly services, a comprehensive youth-friendly services. When I say the key word is comprehensive, it doesn't entail just HIV testing, screening for OPD and all that. It entails a multi services. Apart from HIV testing, STI screening, we have component of mental health, we have component of antenatal care, we have component of them having a discussion with their service provider and giving them their in terms of their voice. We have also, around the youth friendly, we have the suggestion box. They will tell them, kindly don't put your name. Just write the comment how the services are, and we sit in a group of facility in charge, the people, the service providers who are providing youth friendly, and we give them feedback. And if you are not willing to change, you're just being relocated to the next place. And the funny thing, some of these adolescents, some of them, they say, for the young providers, they are much okay, but sometimes they also will prefer also an older one just to have a view of a motherly. Sometimes they will wish to have a motherly view just to have a comparison. But from the feedback that I'm getting from the youth-friendly services that I'm manning, it's not that bad. It's not that bad. We are at least at 70. Now, how can we attain 100%? It's up to us now to re-strategize based on the strategic plan that has been launched recently, is to just focus not only on one service. If I come for an outpatient service, it doesn't mean that it is an outpatient service that I will get. I'll have to get a series of services under one roof. And when I'm getting out of it, I've already have a lot of information, including the resource center. We have a resource center where it has booklet of Bazoo. Adolescents get to read while they are in the youth-friendly center. For Bamburi and Junda, we have already started, since it's a standalone, equipping with the resource. We have different civil society who are supporting that facility. So we are looking for more civil society to support the integrated services in our other dispensaries and health center, just to make an impact to our young people.
Wow, thank you so much. This is a lot that the county is doing, and also trickling down to the sub-county level. So we hope to reach that 100% that you've talked about, because again, looking at the health system in the country is not the very best. Public knowledge is not the very best. That even now, with the strike that is going on, the AYP are to benefit from the suffering. How bad is this, And I like what you said. It's like you're reading my mind. When you said that you empower in the youth-friendly services, they are listened to, and you mentioned something about voice. I am a passionate person of voice, using your voice. And my next question is going to be, do you have suggestion box? And then when you just said you have suggestion box in the youth-friendly service centers, I was like, yes, because young people are not limited, and they cannot their voice cannot be limited. Therefore, if you have like the suggestion boxes, it really helps. And this follows up with the question, do they ever post anything in there? Because there's a difference between having a suggestion box, they are aware of how to use it, and they're actually using it and just having it there for the sake of.
Let me tell you, maybe I need to take you through the youth-friendly setup.
Yes.
So we have the peer educators who have been chosen from different youth organizations, the CBOs. So we have 5 in Bamburi and 5 in Kisauni. And in other public facilities, we have some few volunteers. Up to date, they only get small stipend for these 2 facilities, and for the other facilities it's just like a volunteering basis.
Yeah.
So how do we motivate this youth when we have these activities such as polio, HPV? We integrate the CHPs and the youth to go to the society and talk to them, because the youth won't take anything from the CHPs, because they will say they're old people and all that. So these youth peers are the same peers who are creating a link between the youth and the facility, and they will tell them, if you are not dissatisfied with the service provider, kindly write your comment on this, don't put your name, and put it in the youth-friendly space. So the only way you can capture youth is using the same youth to get to them. So that is the way to go. As health, we've seen us as the senior AYP, we need to give the young AYP a chance. So for these 2 facilities I'm talking, there are already good structures in place. For the integrated one, we are still struggling, but we will reach there. If every civil society support what youth-friendly clinic in a public setup, I think we will reach there with information, with youth-friendly desk, with the internet, with desktops, so that the youth is not only coming to seek health services, but also to seek health information. Through that laptop, maybe we will have the health promotion officer already install youth-friendly programs on how to educate the youth and issues of menstrual hygiene, issues of health-seeking behaviors, issues of HIV, issues of gender-based violence, issues of mental health, issues of sexual reproductive health, right? And when you mention sexual reproductive health right, it is the right of a youth to know the changes that are taken through her body.
Yep.
And how they can positively adapt to those changes. We have peer pressures, and the peer pressures are like, why don't you try this? Why don't you try early sex? If you don't try early sex, you're not a person, a youth.
Sadly.
Yeah, sadly. That is the notation among the youth.
Yeah.
But when you...
The myth, actually.
Yeah, it's a myth. But when you give them information for them to make assertive decision, then that will make a very big impact. And apart from that, we have many programs supporting a girl child. But this boy child, that is where the challenges catch up with. Why? We have youth forums suggesting like psychosocial support for the young mothers. We have young mothers forums. We have the Girls Forum for Menstrual Hygiene and all that. Male involvement, they have been involved, but most of the time they turn up in terms of the male boy child. It's really disheartening. You may have a partner who is willing to support that activity, but only to have a turn up. Maybe your target is reaching at least 50 in that forum, but you'll get around 20, half of it. And when you ask, say they are running for video areas, those are the areas that you'll find our young boys watching videos, sometimes using some of the drugs and substance abuse, like they will bang, mirror, among other drugs. So our young boys are really suffering, and they really need this information, because drug and substance abuse is a key thing. Not only a boy child, but the percentage is higher on the boy child compared to our girl child. You can just imagine a girl child having informed decision to say no to sex, but this boy child does not have information on that, regardless of sexual reproductive health right.
But could there be probably a unique reason? Because actually, even a while back when you started, you empathized, you said that, boy child kidogo amebaki nyuma. You mentioned that, there are suicide cases.
Yes.
And umeona ni boy child kidogo amelemewa. So right now you're also raising your voice for the boy child as well, and saying hizo person apatikana, and how it is easier for girl children to, confirm their consent, speak it loud, but the boy child waoni kwa picture. Could there be some unique reasons that as your department, with your, a position you guys have identified, and you feel like, we have to intervene, and this is how we're going to intervene?
So the society has given a boy child, an African society has given a boy child a mandate, a very big mandate. To an extent, if this boy child is experiencing SGBV, it becomes an issue for him to report. This boy child is not supposed to cry. You can just imagine when this boy child is undergoing circumcision in a traditional setup, and when you cry, you say you are told you are not a man enough. So this boy child, since society has ascribed cultural roles and responsibility towards this boy child, the boy child is not supposed to be vulnerable to any occurrence. And most of the time, these are the issues that are dragging this boy child from even sitting in a place having a information setup, because they believe they are the head of everything. They are the head of the family, which we don't go against. That is our cultural belief, but we have to be proactive. There are certain cultures that need also to be uprooted. This boy child is also like a normal human being with the same blood flowing for a boy child and girl child. They're the same, equal. But when you give this boy child this opportunity just to sit down and to be heard, it becomes a melak, because they will say we have to look for ways of sustaining ourselves, and eventually we're going to become the fathers of the family. But unfortunately, due to this pressure, big pressure put on a boy child, some of them deviate to drug and substance abuse. You can just imagine, have taken a loan to go start a small business, and it didn't go as planned.
Wow, that is pressure. And you're communicating loudly and saying that, the cry is so loud that the society toned down. Boy child also deserve to enjoy life. And a message to the boy child: start standing up for what works for you. Because these traditions were there, I don't know how many centuries ago, but now you see with the changing generation, even there is a generation above us that we do not connect somehow. That's why we advocate so much for intergenerational things, so that we connect somehow and we undo and unlearn things that are not working for us anymore, so that we are at par. So boy children in the studio, they are smiling kombali. You're making boy children very happy by just raising that awareness. And personally, I'm calling you boy children. Okay? Stand up for yourselves. Start telling off these outlawed culture and traditional norms that you're put to that make you suffer. Because it is this same that close the boy child in some boxes that they find themselves, I have to be here because I'm a man. Okay? I can't cry. Yo, boy child, wherever you are listening to, kama kuna kitu kimekubana, sahi, I want you to give yourself 5 minutes. Go close yourself somewhere. Cry properly until people go and knock and ask you, are you okay? And say, I'm not okay. Don't you hear me crying? Okay? We have to normalize that. That is very serious. Because personally, I've been to a place in a religious setting where the priest is saying, mimi sitaki kuona mwanaume analia, and much less mbele ya mwanamke. I will tell you confidently that from that time, because I don't understand. You see, when those are some setups which have a lot of following, that kila ambacho anasema, it is followed. You get? So again, we even calling the, religious setup, the people, to just embrace the culture that are useful, ambazo zinajenga the young people in good ways. Because you see, this generation, we call it popcorn generation. They learn as they go. Wewe unaanza kueleza kitu washaishika wanaendelea nayo. So the moment you start telling them what they can do or cannot do, it worked for our forefathers, but it cannot work for the young people, the like of Rajabs and all that. You get? Now, I liked what you said so much about the social media, and trust me, especially in your jurisdiction, Nyali sub-county, the crazy things going on with young people and, places that could have fun and all that needs a lot of regulation. But before we continue, I want to just take you back a bit. You mentioned something about parents. Ulezi. And how all you do, this is just a strategy paper, but it needs a collaboration. Exactly. And one of the partners you mentioned, the parents. So how are you empowering? How is this AYP communicating empowerment to parents? Some meeting the parents so that they can meet their own responsibility.
Thank you very much for giving me this opportunity. As I've already said, it is a multi-sectoral. So the education department, the NGAOs, those are the local administrators, the key people, and the civil society, the key people who will help us to reach the parents. Like for schools, we've gone to different schools within Nyali. Among the schools like Hadija, I cannot remember all. Hadija Primary, we have Mohammed Ali, and many others, just reaching out to parents. And the good things about schools, we have teachers for guiding and counseling who will raise an alarm to the management, and the management will reach out to the health department saying what you need to come to school, because we have some cases of SGBV. Wouldn't wish these cases to be just done through the kangaroo courts.
Yeah.
So we really appreciate the education sectors. We really appreciate the NGAOs. Those are the office of the DCC through the chiefs, assistant chief. They have really played a big role. And even civil society, they have gone out of their ways just to go to schools, just to be in the community, health educating our young people about the issues of parents. Parents have been reached, not that they haven't been reached, but this AYP strategy, categorically, they are targeting parents. Because we cannot settle issues of AYP without holistically thinking of that family setup. That family setup is a count. if I live in a environment which is very hostile, my dad always drinks, my mom is always beaten by my dad, then what kind of environment when I grow up am I going to be? Maybe to be like my daddy, beating my mommy, and you abusing the drugs. So I think the first role model is the parents, the father and the mother, and the environment around the family. So if we can reach these families, depending on their challenges, most of them will say social economic, but not really. We have a child who comes from a very well-off family, but still is experiencing mental health challenges like depression and all that. And in this new strategy, we've added mental health.
Oh, wow.
Yeah, we've added mental health among others. Why? It's because we have public participation. We went from one sub-county to the next, and the youth will lead in this public participation. They will ask their fellow youth, which are your key issues that you think the previous strategy did not address, but we need to come hand in hand to address, and they will shout. We need mental health issues to be addressed in the new strategy. We need our voice to be heard in terms of leadership. We need to be involved from planning up to implementation. And from the key thematic areas I've already said, apart from the social, economic, seeking health outcomes, we have the social economic component of empowerment. And then there is a component of youth participation and leadership in youth. And then there is the last component of county leadership, because it has to start from the county. And the county head has already written a blueprint that she's listening to the youth, she's part of the youth, and they will call her Senior AYP, Madam Selina Githinji.
Amazing, knowing the great work you do, and of course with the great leadership you have through Selina. And also the way umesema katika nyanjani, those who deal directly with parents, we also recognize the CC of Bamburi. She's been doing an amazing job. And I like one particular thing you've also said about sub-county engagements with youth, sort of like open forums. And from where I see it, I think one of the best ways to achieve, because this is an AYP, without the youth themselves knowing it, it makes sense.
Yes.
But then with the past experience you've had in the last AYP for 5 years, I believe that is one of the reasons that has informed, making this sub-county public forums. Will it be frequent? How frequent will they be?
So we'll want, if all goes well, at least in a month we have an open forum just to listen. But if depending on the availability and even some resource need to be mobilized,
yes,
you cannot call young people in a place where there are no shelter, at least to give them refreshment for them to listen. Most of them will listen when they're in a community hall, engaged in a positively, and you put them refreshment, they will talk their mind. But we really need these open forums, just to sit, listen to them expressing their issues, and including the marginalized. When you are living within the urban areas, we also have those people who are marginalized, like the peoples of Makirunge, the likes of Makirunge, who cannot get access to this smartphone or even social media and all that. How do we reach them, that particular population? It is through the medical outreaches. We go back to them, having dialogue with them. That is why we call AYP targeted dialogues. They tell us, they give us, through the focus group discussion, they give us feedbacks. We usually do it on a quarterly basis, but if I can get support,
yes,
me, even on a monthly basis, I will call different youth organization and the youth just to come out and speak their issues.
Well, I think that is a very good energy to, kick off the AYP strategy 2024, 2029. And I look forward to these forums because mostly you find that this AYP strategy is mostly known to the civil society than the youth themselves on the ground. So you've had Razia Miraj, the AYP GBV mental health coordinator for Nyali sub-county. And if you're out there and you are a civil society organization and you are an independent donor, or you're somebody who just want to support matters of AYP, adolescent and young people programming, then you can plug in to support, the AYP targeted dialogues that the department is planning to conduct to better the health of the young people in Mombasa County. And, when you reach out, you get to choose as well the sub-county you can, support. And also earlier you had her say, reach the department, you can reach her, you can also reach me so that I can direct you, because we are living in the society and communities that we need to make better together. Before I let you go, this AYP strategy, what benefit does it have for the marginalized special people, the people with disability?
In fact, I was almost about to say. We also thank the civil society, especially Dream Achievers Dio. They have played a key role to ensure the issues of the people with disability are also integrated. And when we engage public participation, they were the key front to ensure the people with disability their voice will be heard. Apart from that, in our public facility, we have challenges of accessibility in terms of ramp and wheelchairs. If we can get donors to help us, when you have a budget, that budget, you are limited to series of issues. You will say, I want this, but the money is minimal. And mind you have staffs who are working like casual, who also need to be facilitated. So we are requesting our donors, our partners, our civil society, kindly come through for our public facility for us to make youth-friendly services to the people with disability realized. Because in the AYP strategy, it is the key issues that was brought up. In the previous one, it didn't capture. But this one, it has really captured people with disability and the marginalized community.
Yeah. And we really thank the plans such as CIDP.
Exactly.
I see the strategy has also tapped in the CIDP and knowing that this is the plan for the county.
Exactly.
So hopefully most of the programming is budgeted for even within the ADP, because we are looking forward to this community, this nation, that the people paying taxes, and therefore they need delivery of services. And because that is actually the only surest way that we are anchored. You see, hoping for donors pia ni patapotea, even if it comes again, saa zingine unaona ikichelewa. We need our government, we need our county to come through for us. So the young people are waiting, they're watching, and they're loving their county so much that the county cannot afford to let them down. Therefore, there is need for even increasing the budget itself on health, so that the young people, the future, the so-called future, okay, we are active now, but they are the future, so that they get health programming, health services that can push them to the future they want, right? So we're having a great vibes here on social media, where we have Ronald saying very engaging conversations, and we have Gilberto all the way from Italy.
Wow.
Liking the conversation. We have Safe Jira liking the conversation. We have Brian, Sam Loco, all the way from Nigeria, liking the conversation. We have Frederick Lamar. Could this be from Haiti? I don't know. But liking the conversation, we have Rajab showing all the love for the conversation. So really, thank you so much. This has been a great conversation for me sitting here listening to all the good plans and hoping that we're gonna reach the 100%. So I'm leaving you in the next 1 minute, okay? Just at a point where we need to take this AYP strategy seriously. Okay, so is there any other thing you'd like to share with regards to AYP?
First of all, I will also need to acknowledge our beloved governor. If it were not for him, we wouldn't reach this launching. He has really given his full support. Without forgetting the leadership of Health Department, we have our CEC, Dr. Sabaha Ahmed. Then we have our chief, both chief for public health and medical service. We have Chief Abdallah Deleno, who has been a key instrumental to ensure this strategy is come to realization. We also have Chief Medical Service, Dr. Shem Pata, who is very passionate about matters of youth. And you remember during the launching, he was very passionate to go through each and every youth organization, just listening to all what you have to say. So the two chiefs, the fathers, remember initially we had the two chiefs who are all ladies.
Yeah.
Now they are now the male.
Boy child.
So the boy child has been given a priority to an extent. He needs now to foresee the future youth. Without forgetting our beloved Madam Selina. She has been a key instrumental to ensure this AYP strategy has come to realization. Without forgetting the sub-county coordinators, because matters of implementation goes to the sub-county. And it is through us, the sub-county coordinator, myself, and others from Changamwe Jomvu, like Ken, Gitari, we have Sadia in Likoni, we have Itai, Farah in Vita, and Mulki in Jomvu. We have come together just to make sure this process has come to reality. Thank you very much, Maureen, for giving me this.
Before you go, before you thank me fully, what message do you have for the youth themselves? Because this is their document.
Youth.
Yes.
Make informed, assertive decision and stand with your decision. As the slogan will say, nothing for us without us. You are the future leaders of tomorrow. And the AYP strategy has given you fully mandate in terms of public participation and leadership. It is the key component. And the social economic part, you are given the mandate to go back to school even after dropping out of school, maybe due to drug and substance abuse, due to teenage pregnancy. So we are telling our youth kindly, watuachane na hizi dawa za kulevya. We need a healthy, productive AYP to move this country forward.
In a great conversation, where can the young people find you? Are your doors open? Ama wewe ni yule mpaka wapigie simu mara 10 ndio shike?
Hata namba zangu ni zile 0722 875 586.
Chunga, unaweza pata simu za vile uko mrembo, unaweza pata simu za kuambia tunakupenda. So your office location iko wapi?
Currently we are based in Bombolulu workshop. That is where our offices are. Not unless we relocate, because now the two sub-counties have been split. We have Nyali and Kisauni. We are all sharing the same offices. But in terms of managerial, everything is separated. Yes. So currently we are at Bombolulu workshop. Kuna ofisi pale, we are EPDK. On your way, when you ask health offices, they will be shown.
Oh, nice. Boy child, umepata mtetezi. Hii conversation, what have you loved more about it, and what are you looking for most towards in this AYP strategy? Because mekona tu ukismile mdogo.
Napenda kusmile. Unajua jana mimi napenda kusmile sana. Umepata mtetezi. Unajua hakuna kitu kizuri kama upate girl child anaongelea issues concerning boy child.
Yes.
Huwa inafurahisha sana. Na kama alivyosema Razia ni kwamba AYP vijana wengi tunafaa tukue sober to make the rightful decisions. Tunajua drugs ziko mingi sana. Kama unaishi Mombasa, Kisauni, Likoni, Majengo, unajua drugs ziko mingi sana. So tukue sober mind ili tuweze kupeleka ligurudumu la vijana mbali sana, kwa sababu AYP iko pale, na sijui kama tutapata hard copies, kwa sababu unajua serikali yetu inaweza toa kitu kizuri kabisa alafu wakaacha online. Mona soft copy wewe unapata mtu anakuambia iko wapi, sijaiona, nitaipata wapi? Tunakwambia iko online. So that's the biggest challenge to us youth when it comes to anything to do with soft copies. So if kama itakuwa hard copies, tujue ni mali gani, kama iko accessible, reachable, tuende tuipate at least kila moja kwa hard copy. Ndio serikali iseme tulitoa hard copy tukagawanya kila mtu. Kwa nini hamjasoma?
Yes, before she answers it, I want to tell you from my personal experience. There is a time where mtu akisimama pale mbele akisema AYP strategy 2018-2022, nilikuwa naona kama huyu ndio mwenyewe. Huyu ndio nitamshikilia mpaka mwisho. Huyu ndio anajua the way dunia itaisha. You get? But it doesn't have to be like that anymore. Where information iko tuna watu kidogo. So as Rajab says, it's a recommendation to you from Dio Radio that investment come through to print mkienda hizo youth targeted dialogues. At least kabu kamefinywa. Tena si ile copies ile you flip letwaje. Sile zimeprintiwa nyingi. Unaona vile constitution hufanywa? Kakitu kama hako. Imagine ukipea young person atafeel this is for me. I'm required. Lakini mkika ile pepa ndefu vile zile za public participation. Mse anaona ile kirimeshikilia kitoka ya washwa jiko. We want to see something like that. A county that prioritizes, investment to youth, even the best way, information, like it tells a youth you're needed, this is for you. Not like tumefanya hii tumeenda. Can that really happen? Is there a plan? Because we're waiting.
There is a plan, and staki ku preempt, but we have a dissemination that is coming around on 29th of April 2024. We will engage some few stakeholders, around 40 slots, who will now sit down to see how many are going to be printed, how is it going, this information going to, because I've already told you we have marginalized community who have no access to online, and also wish to get this information during our dialogues.
True.
Youth AYP's targeted dialogue. So I wouldn't wish to preempt, because we have to disseminate the launch, the AYP strategy, and the key stakeholders who will be there. I think that will also be there. Who will also be, probably, we are hoping he'll be also sponsor the activity. So let's wait and see. And I believe all is well.
Inshallah.
Asante sana. Msikilizaji, that has been Miraj Razia at the studio. She is the AYP GBV Coordinated Mental Health at the Nyali Sub-County. And of course, she has told you that her office is accessible. She is also accessible. She just gave you a number. If you're too quick, ulishaishika. Kama kushika, kesi baadaye.
Social media handles.
Your social media handles?
I'm a very simple person. In terms of social media, it's WhatsApp, Facebook. I'm one reserved person, but I will, from here, maybe you have given me a homework.
Okay.
I'm going to work on it.
Sawa, and we'll make sure that we follow you. You can find me on social media across all platforms. Just search Maureen Magak, na utanipata. And really thank you so much for sticking up with us. And I hope that utaenda teke kwa Google ku search AYP so that you know what it's all about before the AYP strategy 2024-2029 hits the ground. Asante sana. Thank you so much.
Thank you very much.
Ukitaka kunyonga